Hey guys, Coach Gaglione here. This is another edition of our Training Through Around Pain series. So again, just quick disclaimer, I like to kind of just shoot this message, provide this message before each video that we're kind of in this particular series. I am not a medical doctor. I am just a powerlifting coach. I have 13 years of experience powerlifting and coaching athletes. So this is just purely anecdotal, just what I've kind of found has worked for myself and our athletes in the past. If you are dealing with a real serious issue, I do recommend getting it checked out. A great resource for that is clinicalathlete.com. You can find a provider in your area and get an assessment. But either way, we're going to provide some tips and tricks, what's worked for us in the past. When it comes to shoulder injuries, it's something that's kind of really near and dear to myself because probably more than anything else, this is probably the area that has given me the most trouble. Starting out with, like I said, I was an athlete, I was a football player and a wrestler, and I kind of dealt with a lot of different, kind of head-to-head collisions, getting my shoulders in precarious positions, especially like arm bars and things like that in wrestling. Those could certainly, definitely be a factor. So I've dealt with a lot of achy shoulders my whole life. So even though I will say that it's kind of funny because I always, if you look at me, like I do have a pretty big rib cage. I would say I am probably anatomically built to bench, but benching has always been problematic for me, partly due to a lot of poor habits. I didn't really have a lot of great technique coaching when I was younger. Not to say I didn't have great coaching, because I did, and I learned a lot from my high school coaches, but I didn't really have the best technical advice when it comes to benching specifically. And I did a lot of kind of wear and tear, a lot of bouncing reps and things like that. So we're going to talk about that. And again, like I said, I've been dealing with some shoulder injuries, especially as I've gotten leaner. There's definitely the shoulders have been the most problematic for myself. So I'm going to kind of give some advice on what's kind of worked for me, and also I did dislocate this shoulder. That was one of my worst injuries that I've had, and I did partially tear all my rotator cuff muscles and my labrum on that side. So I definitely have some a lot of personal experience with this one in particular. And I would say besides lower back, I do think the shoulders probably are really up there with something with weightlifting related injuries. So number one, I think that's a really important thing to note. Right now, like we talked about a little bit in the squat, in the video about kind of elbows and things like that, and throughout the whole, when it comes to all these, especially the smaller joints, you really need to consider the frequency of the lifting you do. So right now, kind of high frequency training is all the rage. So if you're benching 2, 3, 4 times a week, just realize that increased frequency is going to have increased risk associated with it. If increasing frequency is a goal for you and you feel like that's going to help get you stronger, I do recommend transitioning into higher frequency programs slower. So a good way to do that is let's say right now if you're benching twice a week, if you want to bench 3 times a week, if that's a goal for whatever reason, instead of just doing another barbell bench, maybe you just do another pressing movement. Maybe you just do some push-ups on the third day, or maybe you do some dumbbell pressing, something that's a little bit less intense on the body. One of the things that's the same thing, we talked about this, especially in the elbow episode, when it comes to something like a straight bar squat, consider how that's going to also affect your shoulders if you're increasing the frequency of squatting as well. So if you are consistently squatting with a straight bar and that's all you do, if you are squatting multiple times a week, and if you're already getting specific training 1 to 2 times, why not throw in something like a belt squat? Why not throw in something like a safety squat bar? Or even a leg press if you want to increase that volume or that frequency of a squat specific movement. It doesn't always have to be the competition lift. So I would say when it comes to squats and bench pressing specifically, in the case of the shoulder, number one, it doesn't always have to be a straight bar if you want to increase your frequency. And number two, if increasing frequency is a goal for you and that's a style of program that happens to work for you, just realize that increased frequency is also going to increase your risk because you're getting those exposures quicker. So it's going to lead to, so if you're going to increase your frequency, consider adding a little bit more variety to your training, especially if you're far out from a competition. And also consider when you're transitioning to higher frequency training, start with lower risk variation. So for example, in the case of a squat, something that would be lower risk would be something like a goblet squat, a belt squat, or a leg press, for example, versus just doing another straight bar squat variation. So those would be more intense in nature. For benching, adding in things like dumbbell benching or push-ups, Those will be more pressing variations, but you're not going to be able to use as much load. It's going to be a little bit easier on your shoulders, etc., etc. So number one, just look at your programming. If a certain joint, whether it's shoulders or not, if a certain joint is really like achy all the time, maybe you're overworking that area. So maybe you need to kind of take a step back and adjust the program accordingly. And it's something, if you are working with a coach, it's something you should have a conversation with your coach. So there's definitely a time and place for higher frequency training, so I'm not bashing it. But I do think you need to think about longevity long term, especially when it comes to injury prevention and just feeling good and having that like long-term success. So another thing that's going to be important, I would say, is this is specifically a little bit more, it could apply to the deadlift as well, but more specifically to squatting and benching. Check your grip width. A very common piece of advice is if your shoulders hurt, use a closer grip for benching. So while on the surface, I do think that this could be a good piece of advice for a lot of people, it's not necessarily good advice for everyone. So for example, I am definitely falling into that category. I actually prefer, it feels better for me to have a medium to wider grip when I bench. I actually will feel better. It will feel better on my shoulders using an ultra wide grip, even an illegally wide grip where my fingers are outside the rings, which I would normally train like that anyway, but if I wanted to, that would actually feel better to me personally than a super close grip bench. And the reason being is I don't have a lot of internal rotation. And basically, internal rotation is going to be this motion here. And the closer, basically, if I'm going to bench with a closer grip, I'm going to need a little bit more internal rotation because naturally I'm going to touch a little bit lower. So if you think about like a decline bench, for example, so I'll just kind of artificially make a decline bench by just bridging up here. So in order to hit the highest point of my chest, I'm going to need a lot of internal rotation in order to keep my joint stacked over, my wrist stacked over my elbow. If I set up in a normal bench position and I can bring my rib cage higher, I don't need as much internal rotation. And if I'm in an incline position, so the closer I get to stand like an overhead press, the overhead press is going to require the most external rotation. So if I can imagine if this is like an overhead press position, if this is an incline press position, if this is flat bench, decline, etc. So the more I get towards a decline position, I'm going to need a little bit more internal rotation, and also the closer grip I have on the bench, the more internal rotation you need to have. So you can't just follow a blind rule. You need to assess yourself. You need to check yourself. If you don't have a lot of internal rotation, you're probably not going to be able to bench with as close a grip. So what does that mean? If you're having some shoulder pain, don't just bring your grip in closer. See actually what feels comfortable to you. So use a grip that's comfortable to you. Where usually like that medium grip is going to be the best option for most people. So if you go ultra wide, that could be problematic for your shoulders. If you go ultra close, especially if you don't have a lot of internal rotation, that's going to be problematic for your shoulders as well because it's going to want to project, which we'll talk about in a second. So if close grip bench is something that's programmed for you, just realize that, let's say if you're like, I like to bench with my middle finger on the ring. If I move in one finger closer, or 2 fingers or 3 fingers closer, I would say, anywhere from like 1 to 3 fingers is plenty enough of a variation where you'll get some sort of training effect. So I like to bench typically with my middle finger on the rings. If I do a wide grip bench, I'm going to put my index finger on the ring and I'm going to try to keep my elbows out a little bit more to work my chest. If I do a close grip bench, I'm going to bench usually with my pinkies just inside the ring, which for some people that's not necessarily a super close grip bench. Most people would consider a close grip bench like a thumb or half a thumb from the smooth. But if I go in that close, especially if I'm doing a full range all the way down, I might do that for like a board press, but not full range. So it's going to be dependent on the person. So make sure that you're not just following some blind rule. As long as you are kind of respecting your body, you can still add variety to your grips and get some training effect from that, but make sure that you're using an appropriate grip for your structure, okay? So that's number one, check your technique and check your grip width. So when it comes to technique, another thing is just making sure you're setting yourself properly. So we want to make sure that our shoulders are retracted and depressed. We want to make sure that they're retracted and depressed. So retracted and depressed. So a good way to kind of make sure that you do that, you can use the uprights of the bench, or you can use the bench press itself and start to wiggle your shoulders down. So my chest is up and I'm getting a lot of length in my pec here. That's me protracted and that's me retracted, so you can see the difference there. If you have a softer bench pad, it definitely helps as well. So one of the things that we like to have, we have like a kind of a padlock gripper as well that'll help you kind of from sliding. You can also put bands in your bench to kind of prevent you from sliding. So if you're sliding all over the bench and you're not really stable, that's going to be problematic as well. So make sure you're benching off a firm pad. And like I said, if you want to attach some bands to, if you don't have like you could use something like a padlock gripper is great. It's a great option. You can check it out to prevent you from sliding. You can also put like just jump stretch bands on the bench as well. Okay, so now we're going to talk about scap position and scap mechanics a little bit. So when we're benching, we want our scaps to kind of be pinned down. We don't want our shoulders really going through a big range of motion. So that's going to be like kind of the biggest difference between like a bench press and then like a push-up. Where something like a push-up, the scapula is going to kind of move freely. This comes with something called like a scapular-humeral rhythm. So as your humerus moves, your scapula is going to move with it. So it is important to kind of train those things, but just realize from a powerlifting standpoint, especially when we're squatting, benching, and deadlifting, we're going to kind of have the scapula kind of pinned down and positioned where we want it. So what I like to do is just to educate people kind of the scapular position anyway. Try to get it in a neutral spine so we're not just substituting retraction for lower back extension. So I like to instruct our athletes to just kind of round their shoulders all the way forward and then pull them all the way back and then just kind of lift the arms up in position so like they'd be in the bottom of the bench press. And you can see I'm going to have a lot of length here, and by having a lot of length in my chest, it's going to allow me to use that muscle. It's kind of similar to like sitting back in a squat. So by sitting back in a squat, it's going to put my hamstrings on tension. Same thing in a deadlift. So by loading up those posterior chain muscles in like a squat or a deadlift, same idea with the bench. I want to get a lot of length in my pecs, so that way I could use that muscle on the way back. So if I'm here, that's going to make my muscle kind of bunched up. Here, it's going to make it nice and long and stretched so I can use it in the bottom. So my shoulder blades are retracted into press. I'm kind of pulling them together and down. Another cue is to kind of pull your shoulder blades in your back pocket. There's a lot of different kind of things that we want to work on, being able to move the scaps and then being able to hold them in position. Which leads me to our next point. So when a lot of us, especially again since specificity is so popular, some of us that are watching this, maybe hopefully not you, but we don't do any type of bodybuilding accessory work. So I think this is definitely one thing that Westside and those guys really have to do a great job of, is really hitting that accessory work hard. In particular, you want to do a lot of horizontal rowing or horizontal pulling variations to balance out what you're doing. Admittedly, I don't do the best job of this, but we do a lot of back work at ganglion strength, and you're always going to be working the back no matter when you're doing powerlifting. But I think it's really important that we always try to add in more and more back work. And we'll can you grab a band? And we'll show you some exercises that you could do that are really simple with a band as well. Okay. If you have a lot of shoulder pain, you start to kind of reduce your pressing volume and increase your pulling volume. So a good recommendation is for every press you do, you want to do 2 to 3 rows or 2 to 3 kind of pulling exercises. In general, we do a lot of horizontal pressing. We don't do a lot of vertical pressing. We usually do a lot of vertical pulling and not so much horizontal. Thanks. So we're going to show you some exercises that you can do with some bands as warm-up and just to increase that upper back volume. But basically we want to make sure that we're getting a lot of upper back work in. So that's going to be really critical. A lot of us overdo the pressing. We don't do as much pulling to kind of balance things out. So for healthy shoulders, having higher amount of volume of pulling, especially specifically horizontal pulling to pressing, is going to be really key, especially during times where you're having some shoulder issues. Okay. So now the question is, and this is something I always think about a lot, is how should we perform rows and pull downs and things like that. So when it comes to specificity, I do think there's some value in starting with like a retraction and holding that retraction and then going through some rows like that. I do think though from a shoulder, and because that's going to be more specific to powerlifting, so in a powerlifting bench press we want to pin down the scapula and really not let it move. But from a shoulder health standpoint, we do want the shoulder blades to move. We don't want to really get too stuck. So I do think that sometimes we could just literally work on retraction. We could do like a scap pull-up. We could literally just work on depression. And you could just hold those positions, and you could literally just work on moving the shoulder blades independent from the arm, which is an important skill in itself. You could also do a retraction and then a row and then let go of it, and you could do, so that's going to really specifically kind of work the retractors, and that's going to be a little bit more specific to powerlifting. When it comes to just general rowing mechanics and scapulohumeral rhythm, I do think it's important to just let the scapula kind of have its normal rhythm, so we're not going to necessarily pin it down right away. As we go into more shoulder extension, in the case of a pull down, our scapula is going to naturally depress as we finish the motion. As we're going into more shoulder extension in a row, our scapula is going to naturally retract as we finish the motion. What a lot of times we'll see when we have poor scapular mechanics when we're pulling, we'll see instead of doing the lap pull down, they do the lap pull down, which you don't want to do. So you don't want to do the lap pull down. So I'm going into internal rotation and protraction at the bottom, which I don't want. I want to be retracted and depressed at the finished position. And then I can elevate once I reach overhead. And as I come down, I retract. So a lot of people will go too far and they'll internally rotate and protract. So the same thing with a row. As I go through that range of motion, I want to be fully. So a lot of times people will think about trying to drive their elbows really far, and then I go into internal rotation and protraction. So just think about sticking your chest out the whole time, and don't worry about where the elbows. I mean, I think pulling with the elbows is a good cue to kind of feel that, because that's what's driving it, as opposed to the hands. But just make sure that you're not necessarily trying to get the elbows so far back that you can't maintain position. And even with no weight, I'm feeling a good contraction in my back, and I think it's really hard for people to kind of feel their back. So again, there's a couple. If I'm doing a row or a pull down, I can start it with a hard retraction or depression, and then go through it, or I can just have that natural scapular humeral rhythm. But in either case, our finished position is retracted and depressed. Our finished position is retracted and depressed, and that's going to have the best transfer to shoulder health and building up your back. There's no row contest in powerlifting. You just train the back as a supplement. You're training it for increased shoulder health and shoulder stability, and to build a bigger foundation for your bench, squat, and deadlift. So if you're just doing sloppy reps, that's not going to really benefit or transfer over as well. I recommend doing isometrics. I recommend adding longer pauses at the top so you can really feel that position, especially if you are having some shoulder issues. So other considerations, we talked about internal rotation, and we touched on external rotation. So you're going to need to have enough external rotation, obviously. We talked about this in like our squat, some of the other videos. So in order to do a low bar squat, we're going to need a certain amount of external rotation. And if you don't have as much external rotation, you're going to need to grip the bar a little bit wider. So that's going to be important from a squatting standpoint. From a gripping standpoint, when you deadlift, again, usually the bigger you are, you're going to have to hold it a little wider. Using the example of like a Brian Shaw, even their conventional is going to be pretty wide because their shoulders are wider. So just in general, the wider you are, you're going to grip the bar a little wider. And I would say in general for all three lifts. The one, like I said, squat might be the one kind of caveat if you do have a lot of good amount of mobility. I know Jen Thompson will actually measure the distance between kind of the clavicle, and she has a certain formula that she does, and that's how she kind of gets her grip for her lifters. It's very, very specific. Now, I don't think you have to be that specific, but in general, if you have a wider kind of chest, you're generally going to grip it a little bit wider, as a general rule of thumb, just to kind of appropriate, so if you're a smaller person, you're probably going to grip it a little bit closer. If you're a wider person, you're probably going to grip it a little bit wider. But see what works for you. The other thing I would consider, if you are a powerlifter and you do like to overhead press, make sure you have enough shoulder flexion to do that. So the best way to do that is to actually go against the floor, against the wall, and to make sure you can actually reach your arms overhead without extending and cheating through your rib cage. So my rib cage is stacked over my pelvis, and ideally I would do this against the floor, and I would make sure I have full range of motion in my shoulders. A lot of powerlifters don't. So if you don't have full shoulder flexion, I recommend doing something like a landmine press or an incline press to kind of get that kind of overhead work without actually going into a range of motion that your body can't handle. Which is one of the reasons why I don't really program a lot of overhead work anymore for our people, just because I would say a lot of people don't have the requisite mobility. Not to say you shouldn't train it, but in general, probably something like a landmine press or an incline press where you're not quite overhead, but it's getting close. You can still get a lot of shoulder work, you still get a lot of tricep work, and it's still going to give you a lot of great benefit. So if you do want to start to work to the point where you are going to work overhead, obviously doing some tissue work and some kind of mobility type exercises to kind of make sure the nervous system is kind of calmed down with the pecs and the lats and things like that, so you can kind of increase your overhead range, is going to be really important. So we also, I think we'll include it in the description below. We do have a lot of drills from our seminar talking just specifically about lat tension. So doing lat tension drills before you bench squat and deadlift is going to be really important for keeping your shoulder health and shoulder position. So that's going to be a big factor as well with how you warm up. So in the case of a squat, we're going to be squeezing our lats this way. In the case of a bench, we're going to be squeezing our upper back and lats that way. And then in the case of the deadlift, we're going to really focus on getting a lot of depression to engage the upper back there.